Good morning, everyone. Today, I want to help you out to ask the questions. Are your patients or some of your patients fogging you, and what does it mean? First, for credibility, my name is Khaled. I have been a dentist for 20 years. I run my own dental practice, Lakeside Dental Spa in Hervey Bay in Queensland. I took it from one chair to 10 chairs over the course of 15 years, and you can check my details below for credibility. So what do I mean by patients, some patients fogging you? They're using something called fog, which is fear or obligation or guilt, to like put a lot of pressure on you to do things that you don't want to do in dentistry, for example. So we are not trained in psychology, which makes sense, sad, but which I wish we had some, because we're not going to treat patients psychologically, or we're not going to treat any of the psychological problems. But I think it's important to identify some certain behavior patterns in some patients, not luckily not majority. There could be some patient with some personality disorders or that it's not your job to fix, but it's your job to identify certain things they will use to put pressure on you to do things that you're not comfortable doing in dentistry. So hopefully you can identify them and create a bit of boundaries and create a system on how can you respond to those patients and how you can help this patient. Because the aim is for you to be comfortable providing dentistry to your patients. Because if you're not comfortable, you're not gonna give your patients the best care. And the aim as well as those patients, nothing wrong against them, is just to treat them in the best way you can possibly treat and not doing something that's gonna be compromised, it's not gonna work long term. So let's talk about fog. They will use fear or obligation or guilt. So if you find yourself in a very you feel like pressure when you're treating a patient. You feel like when you see this patient name in your appointment book, you feel like your heart starts to like race a little bit. You start getting a little bit anxious. You think about this patient a lot, about their case a lot. I want to stop and just identify whether they're using one of those three tactics on you or not. And if they are, I want you to be equipped to deal with those patients, especially in a new patient exam where it's first time to see the patient, you don't know them well, and you know how to deal with that. So fog is fear, obligation, or guilt. They will use one of the three or a combination or two of the three, or depends on the personality of the patient. Number one, fear. Let's say they are demanding something that you cannot provide. So let's say they want to have, they come in for a checkup. They know it's a dental examination. It's been very clear from the beginning, it's a dental examination. But on the day, they come in and say they're demanding you to fix a filling. That's not urgent. It's not in the cosmetic area. It's not causing pain. It's just demanding that you fix this filling in the appointment as well. Do a scale and clean, and maybe, I don't know, do some whitening as well. Like just a lot of elective stuff, and they're demanding you to do it. And you can simply say, look, I can't do this today. We can only do an examination. And they say, okay, if you don't do this to me, I'm gonna go to my social media, I'm gonna go write a one-star review. They're basically scaring you. They're clearly saying, I'm gonna go to the dental board. They're using a fear tactic on you. You can be very uncomfortable, and you might, sometimes we take it during your busy day and you're like, okay, you know what, okay, let's do the filling. And you're trying to rush and do the filling, you run late on the next patient, you do the clean, and you don't really do a great job because you're trying to rush it. So you think you're doing the patient a favor by submitting to the fear, but you end up not doing a good dentistry. You end up being stressed out as a patient. Patient's not happy because they didn't get a good treatment as well, and they end up complaining anyway. Second thing, they might use obligations. You're obliged to fix all the problems, even outside dentistry. And those patients will be something on the line, let's give the example. They have periodontal disease, and you're doing some perio treatment on them, and you give them clear instructions how they should brush their teeth and control their perio, and they still feel they're not doing that, but they keep saying like, oh, it's your job to fix this perio for me. I'm coming here to you for advice. It's your job to make sure you clear me from that disease. And he's trying to explain to them like, but you need to do 1, 2, 3, 4. Like, no, I haven't done any of this. It's your job to fix for me. I trust you, doctor. It's on you. You're the one who has to fix it. Same aligners. They come to you and you're trying to explain to them they have to wear their aligners a certain way, and it's like, oh, it's your job, I trust you, you're the one who should fix this for me, it's your, I trust your abilities, your skills, you are the one who has to fix their problem. Or they could be crying about certain things happening in their life, and they want their smile to help everything in their life, and it's your job to make them feel happy about themselves by fixing the smile. So you're obliged to obliged to fix everything in their life, basically. So last thing is guilt. So they want to guilt trip you into treatment or doing things that you're not comfortable doing. So it will always be, sometimes they might be a little bit crying, a little bit of a poor me, like kind of like personality, and they'll be like, for example, if you're trying to talk to them about certain treatment, and they will tell you, "Ah, poor me, you know, why are you charging so much for that? How can you justify charging this much? I don't have this sort of money. How are you gonna fix this for me now? I trust you. I want you to be my dentist, but I don't have this money. You have to fix for me. I'm only on this limited funds. I'm only this pension, or I'm only on this salary. Or how can you justify yourself charging this much for someone like me who can afford that?" So they're trying to make you feel really guilty about providing dental care for them, and you have to do it for cheaper or do a discount for them. Or you're trying to take a tooth out and the tooth is not restorable and they want to have filling. How can you take this tooth out for me? You're gonna cause me a lot of problems without this tooth. I'm gonna have a missing tooth on my back tooth and I cannot afford to replace it. But dental problem is not your problem. Your job is to fix it for them, and the only fix is extraction. So they're trying to really make you feel so bad and so guilty about it. So the management of all of them is very similar. But first you need to really step back and identify, am I comfortable or not? Is this patient trying to scare me or trying to make me feel obliged that I have to fix their life and their problems, or is they trying to guilt trip me? And if it's true, use my EIC, which is Example Impact Outcome Change Way. And I have videos on EIC, how to give feedback. But I would tell the patient, look, you know, I want to talk to you about something, and probably you didn't mean it. Make it very clear. I'm sure you did not mean to say it this way. I'm sure you didn't mean that. But when you said, and you bring the example in exact words, when you said, like when you said that I'm charging you too much and you're a pension, I should charge you less, example. Well, that makes me feel very uncomfortable and makes me feel that, you know, I'm trying to just make money. I'm not trying to provide you the service that you require. I'm here just to make money on the expense of your situation. So that makes me feel very uncomfortable to treat you, and I'm not sure whether we can continue on with the treatment if you feel this way about me. So if you still want me to be your dentist, how can we do this differently? You're asking for the change. How can you do it differently? From there, two things. They might change their tone, and hopefully some people are really good inside, and they might, you know, understand, yeah, okay, yeah, that was a bit out of line. Okay, how can we do a payment plan? How can we do that? Maybe I can afford it. Let's call it a day and just shake hands and move on. Or they might still keep going, guilt tripping you, and then you kind of create a boundary here, especially for the new patient. Look, I don't think I'm the right dentist for you, and you give them all the solutions for their problems and just create some boundaries, have clarity, how can you fix this problem for them, and whatever they ask, and if it doesn't match with what you can offer them, just apologize gently. Look, I'm really sorry, maybe I'm not the right dentist for you. Thank you so much for your time. I'm not gonna charge you for today. Sometimes I do that. I don't charge them for the examination because they're gonna go and see another dentist to pay for another exam. I'm not gonna charge you for today. It's our first meeting together. I don't think I can help you. I'm not gonna charge you so you can use these funds and pay another dentist to do your exam. Thank you so much. Whatever records we took, happy to send it to your dentist, a new dentist, so you don't have to pay for it again, and call it a day and shake their hand, wish them all the best in a nice, friendly way. So that's how I deal with patients if they're using FOG or fear, obligation, guilt. Again, many of them will change their tone, which is great, win-win situation. Some of them will not change their tone. Maybe then I'm not equipped to deal with their problem at the moment. I would rather someone else, maybe more equipped, more experienced, can help them with their unrealistic expectations. If you find this information helpful, make sure you like it and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel, and I will notify you when more videos are released. Thank you so much for listening to me. It means a lot to me.